So PJ, head injuries we know happen all year long. However, when the weather gets nicer, we start to see the little ones outside more playing at the park. Our athletes are getting outside playing sports. We're seeing a lot more head injuries and accidents than we do see in the other times of year. What can we tell our families to help prevent, hopefully, and take care of head injuries when they do happen?
So anytime I see a family or I talk to a family that has had a child with a head injury, there's a couple of key points that I always tell them to be on the lookout for. Obviously, if there's any loss of consciousness, that's concerning. Change in pupil sizes, confusion, dizziness, excessive vomiting, if your child is more tired than normal, if they're younger and they're unable to speak, inconsolable crying, where you really just can't get them to calm down at all. These are all big red flags that I would say just go straight to the ER, and your child should be evaluated further by some sort of a provider in an emergent situation. God forbid there was any sort of a serious head trauma.
Absolutely. And older kids who have sports injuries, they can report their symptoms more. They can tell us if there's dizziness, blurred vision. They also should be very carefully evaluated. However, they can tell you a little bit more. The little ones, like you mentioned about irritability, if they're not their same personality. Many of these children hit their head so hard and the parent thinks for sure there's a problem, and they get up, they stop crying, and they play again. If they're acting well and you can observe them, for a few hours at home, then that's fine. If there's any new symptoms, like you said, vomiting, other kinds of irritability, weird loss of consciousness or loss of connection with their family members, that's something that definitely should be seen.
For sure. Sure. I mean, all of this information, it does not replace any advice we would give you over the phone. So if your child ever has any sort of head injury, it's probably best that you reach out to us, even if it's after hours, so that we can evaluate him or her further. But it's very important to keep this stuff in the back of our mind, just because there's so many injuries that occur in these months throughout the year.
Absolutely. Thanks for listening, and look at our website and check our phone tree. If you do call, we have some good advice there too.
Thank you.
Thanks.